Since the introduction of breast augmentation to the American public in the 1950s, nearly 3 million women have undergone the procedure. There are three main groups of women who seek out breast augmentation. The majority of women are motivated by the desire to attain a more proportionate figure. Oftentimes, the breasts have never fully formed. Similarly, other women take advantage of breast augmentation to balance out breasts that have developed unevenly. The third group of women may have been satisfied with their breast size at one time, but their breasts have shrunk or sag as a result from nursing children or aging. Joining us today is our guest medical expert, Dr. Mark Mitchell-Jones from Atlanta, Georgia. Dr. Jones offers more than 15 years' experience performing breast augmentation. Doctor, how do you determine the size of the implant?
Pat, the size is determined primarily from what the patient desires, but there's some restrictions or medical guidelines that we use that depend largely on the circumference of the chest. So I have found that within those restrictions, the best way is to use old implants that I have to actually stuff a bra with a patient, and that way she and I can both sit down and look at the advantages and pros of a certain size. But I try to let the patient's desires take precedent and then restrict them when they get outside the medical guidelines.
Okay. And how can you perform breast augmentation without actually leaving a visible scar?
You always leave a scar, but the technique that we use as plastic surgeons is to put generally the scars where they will not be seen. And there's certain areas of the body, and particularly the breast, that have thin skin, and I have taken advantage of those in my own techniques. And I can make a very small incision, about ½ an inch, in an area that I cannot find the incision in many of the patients afterwards.
Okay. Now, the producers here at MDTV have really traveled around the country looking at all different practices, and they were very impressed with yours. What would you say is particularly unique about your technique?
One idiom that you have in plastic surgery breast augmentation is the implants tend to go in the direction which they're put in. For example, if you put them in on the side, as they heal, there's a weak point on the side, and the implants tend to go to the side. Well, my technique is to do it from the front. And most women want their breast implants to come forward, which gives you more projection. So in this way, you take an advantage of a potential problem that you have with the other ways.
Okay. And is there any one particular type of woman who you would say is the best candidate to have augmentation done?
The three types of women with three breast problems that women come with. One is the asymmetrical breast, one didn't grow, one did, or someone who never grew, or hypoplasia of the breast is what we call it, small breast. A third group, which is getting more and more common, is after breastfeeding or aging, where the breasts droop a little bit. The fourth and most important reason, though, should be for the appropriate reasons. The patient should have the reasons that are appropriate to have breast augmentation. That is, not to do it for getting a man or getting a husband who is divorcing to come back.
Okay. Now let's meet a young woman who, through self-education and advice from close friends, took the time to find a doctor who she felt comfortable and confident with. Her name is Nicole Wilkins, and she's the focus on today's MDTV patient profile.
After the age of 30, I started deciding to be a bit healthier, working out more, cutting my fat intake. I dropped my body fat from 25% down to about 13.5%, and a lot of the fatty tissue disappeared off my body and made me feel a lot better about myself, except for the breast part. And so I had this one particular friend who had the procedure done, and when I saw her, only 20 days after the procedure, I saw her, and she looked incredible. I was so impressed, and I said, I have to go and visit your doctor and find out who he is and talk to him. And I'd already talked to several other doctors before that, but this was, she had Dr. Jones as her physician, and I went and met with him, and that was it. And when he came in, he was so easygoing. He examined my breasts and told me that I was a very good candidate for the particular procedure he wanted to do on me. He recommended this particular procedure to me because he thought it was the best way to go for me. He talks with you as long as you need him to talk to you. He asks you if you have any questions. He asks you if you understand that, you know, what he's explained to you, if it's clear to you or not. And it's easy to talk to him. Very, very easy to talk to him. I feel fabulous. Elated. I don't even need a whole sentence, just one word. I'm elated.